Thank you, Chairperson, and I must thank for the organizing committee for inviting me for this prestigious conference. And this is the first time I'm in China, so I'm very excited, and I'm more excited when cardiologists select something related to nutrition because which is hardly neglected area. And topic is role of a fruit and nutrition, fruits and vegetable in reducing cardiovascular disease risk. During this lecture, I don't have any conflict of interest apart from eating a lot of fruits and vegetables in my day-to-day life. And this is outline of presentation. I start with some background about the dietary factors which is related for the cardiovascular disease risk. And of course, today's topic about the fruits and vegetables. And there are a few landmark studies shows huge benefit of this intake of fruits and vegetables. Because of that, we have to identify the reasons. So there are a lot of mechanisms behind that also. Finally, there are global recommendations also. However, although this is a very simple thing like fruits and vegetable, still we don't have a correct definition also. So there are a few controversies about these definitions I will touch. And finally, of course, as a clinician, you need to promote fruits and vegetables for your colleagues and your patients. So I'll give a few tips as a dietetic point of view. The background, and this study shows diet is very important for our health as well as fruits and vegetables is a very top priority for the human health. You can see this diagram shows for the cardiovascular health, this red color bars for the cardiovascular diseases, and low fruits and vegetable intake is in the top 5 level. So probably you might thinking about high processed meat and probably trans fat and fizzy drinks, but those are not actually reason for the main reason for the cardiovascular disease. And we have done some studies in Sri Lanka also. We found fruits and vegetable intakes very, very low in Sri Lanka. Although it's a tropical country, we consume probably less than half of the requirement of fruits and vegetables. And we conduct systematic review on the South Asian region is similar, and all the South Asian countries eat around 2 fruits and vegetables per day, and recommendations having at least 5 portions. No big difference in China also. You can see fruits intakes around 60 gram. The recommendation is 200 gram. So they also not doing well. But when it comes to vegetable, yes, they are having a 200 grams. But when it comes total, again not satisfactory. So it should be more than 400 grams per day. And especially older group eating less fruits and probably less educated people also eat less fruits. So this is also some concern. Why we encourage these fruits and vegetables? There are few landmark studies. These are 25 years old, but very high quality observation studies, nurses' health study, and professional follow-up. It shows adding 1 fruits and vegetable per day reduces risk for the cardiovascular disease by 4%. And new study shows if someone having more than 8 portions of fruits and vegetable per day compared to those who are taking less than 3 portions, actually reduces risk for the ischemic heart disease by 22%. That's a huge reduction. This is a very interesting study which analyzes how we eat vegetable, not just as a raw, we eat as a cook also. Especially if you go for this bar chart, you can see South Asia and Southeast Asia, this is our region, eat more cooked food, and most of vegetables also cooked there, compared to North America and Europe. So what this evidence shows actually, when it comes to the raw fruits, raw vegetables, there's a significant reduction of the cardiovascular disease event. But when it comes to the cooked vegetables, there are no. Probably because when you are eating cooked vegetable, we are adding salt, probably adding oil, there are a lot of other things, probably we lose some nutrient and probably adding something wrong also. And China also, there are some studies shows this people who are eating low fruits and vegetable intake have very high risk. So they compare the lowest quintile to the highest quintile, and they found those who are eating highest quintile of fruits and vegetables have a nearly 25% risk reduction when it comes to the cardiovascular mortality, and which is dose related to also. You can see those who are eating more than 400, 500 grams fruits, they have a significant loss in the cardiovascular disease. So these are good take-home messages for all of us. How is this happening? So there are several mechanisms behind that also. When I move for the fruits, and few studies done for the particular fruits items also. For example, you can see grapes and apples and oranges and watermelon. These are like a common fruits eaten by the all over the world. And probably when it comes to grapes, because of polyphenol level, especially in the fruits and seed, it reduces the ALD oxidation and it reduces the probably chance for getting heart disease also. And when it comes to apple, there are again polyphenol, especially in uh, their skin, which reduce inflammation and reduce the LDL and probably improve the endothelial function and reduce the blood pressure. When you go to watermelon, again same. It improves the blood pressure as well as lipid profile and reduce oxidative stress. Oranges again reduce the blood pressure and same time it improve the lipid profile. Papaya also have a lot of antioxidants which provide several benefits. So probably when it comes to fruits compared to vegetable, which have a higher content of polyphenols and some nutrient, and that is probably reason for the having a reduction of the cardiovascular disease. When it comes to vegetable, compared to fruits, big difference between fruits and vegetable. Fruits contain some amount of calorie because of sugar content and starch content, but vegetable contain very little, relatively very little amount of calories. So someone who eating vegetable actually reduce the total calorie intake and probably reduce the obesity also, which is one of the main risk factor for the cardiovascular disease. And other mechanisms are more or less similar for the fruits also. That also provide antioxidants. Some provide fiber, which might work as a prebiotics in our gut, and it provides some nitrate, which also important for the vascular health, and cholesterol, which reduces absorption of cholesterol also. So you can see fruits and vegetables have a lot of health benefits, and there are some mechanism background also for that. Because of these epidemiological studies and mechanistic studies, almost all government agencies and health organizations encourage fruits and vegetable intake. You can see WHO for everyone encourage to have at least 400 gram fruits and vegetables per day. If I move for the heart-related guidelines, one of the first change related to dietary changes is the increased fruits and vegetables, and they encourage eat plenty of fruits and vegetables as well as encourage a wide variety also get all sort of nutrients. And European guidelines so no difference. They also encourage minimum 400 gram of total fruits and vegetables per day, and individually like at least 200 gram of fruits and at least 200 gram vegetables per day. However, even sometimes friends ask, what is a fruit? It's not very easy to answer actually. Probably you might think fruit is, oh, it's very easy. No, it's not very easy to answer. Now if you take a tomato, which is considered a fruit, but we consider as a vegetable. So there are a lot of law cases also around that. There are a lot of legal issues also regarding that. If you take some fruits like watermelon, some this, because sweetness we can easily consider as a fruit. But if you take beans, again it's a fruit. Why? By definition, it is coming from the plant with the ovary. So that's the definition. But when it comes to cutlery, when we are eating things, if it is savory, probably we consider as vegetables. So if I go for the simple definition of the fruits and vegetable, a fruit is mature ovary with a flowering pattern developed after fertilization, typically contain one or more seeds. Of course, there are new plants with no seeds, but still there should be seeds. And so most of so-called fruits are under this, like a watermelon, probably grapes, apple, kiwi, everything under this. So it's very easy to understand. And when it comes to cutlery wise, when you are eating wise, we don't eat this as a main dish. We eat as a side dishes or like a dessert, or probably eat as raw. Of course, we can make apple pie, but we don't eat as a routine thing. But when it comes to vegetables, apart from the fruits, every other plant, vegetative part is a vegetables. So which include roots, stem, leaves, flowers, bulbs. So you can see everything are savory, and there are less sugar inside, and we don't eat these things as a dessert also. So that's a simple definition between fruits and vegetable. Although it's confusion when it comes to some fruits. For example, avocado, consider fruit, but probably it could be like a vegetable because it's not sweet. Second controversy, now we encourage like 400 grams. Probably it is from the epidemiological studies, observation studies, but when it comes to even FAO, the comment is like it should be 80 grams per portions. Again, this is confusing. You can see even NHS says one portion is 80 gram fruits or vegetable. So it's not a one watermelon equal to one grape. But this is very confusing. When I go through all these recommendations is very confusing. If you take a simple things like a strawberry, UK NHS encouraged to have a seven strawberry as one portion. When it comes to American Heart Association, is a four large, but in same country, American Department of Agriculture encouraged to have like a eight large strawberries. You can see it's very confusing. So patients are confused when you ask them to have a portion, and because some fruits are big, some fruits are small. So what is the solution? Actually, we did a editorial on this also. It's very simple. If fruit contain 15 gram of carbohydrate, which we call as a one carb, and which have around like a 60 calories because meal is a sugar, and we can consider one fruit. Most of medium-sized fruits contain that. If you take one small banana, medium-sized banana, if you take one medium-sized apple, contain this amount of carbohydrate. When you got a vegetable, which hardly contain calories, there are very little carbohydrate, so it's around 5 grams. Since you have some protein, it comes out like a 25 gram of calories. So this is the best way to define fruits and vegetables. And for the Sri Lankan context, I develop a atlas for that because patients are really confusing. So we give this kind of live size photo for them to understand this is a fruit. This half apple equal to this branch of grape or this size of banana. So when it comes to fruits. When it comes to the vegetables, again we eat like a curry vegetable, like a cooked vegetable. So this kind of tomato is equal to this branch of cherry tomato. So these are like education material we use to identify the portion sizes. When you are giving advice, you have to eat two fruits, you have to go like a portion size. 3 vegetables, you have to go portion sizes. That's something we have done. How we can improve this? So probably as a clinician, we want to improve the fruits and vegetable intake. There are empirical evidence shows fruits and vegetable important. And again, we did a study about something called plate concept among actually cardiac patient, post-MI patient. And what we encourage, have a lot of vegetables in a plate. Half should be vegetable. And this is kind of plate we gave to them. This dark green area for the dark green leaf vegetables, like a broccoli, or they can have some salad. And orange color for the another cooked vegetable, like carrot or something. And green color for the another green vegetable, like a beans or something. And red color for the meat item or fish. And yellow for the cereal, like a rice. So when they eat rice, we encourage like this. So we also have a lot of vegetables in their main dishes. Not only for the rice, this beyond that. When they eat pasta, we encourage them to put a lot of salads there. Even when they're having a wrap or something, not just like a wrap with a gravy or something, add a lot of vegetable inside, make it like a full vegetable meal. Of course, there are some protein also, but this contain half amount of vegetable for their need for the breakfast. When you cut sandwiches also, we can get a lot of vegetable inside. So this is the tips we are giving for the patients to improve the vegetables. So even breakfast, they can have a couple of sandwiches like they end up with some vegetables. Lunch, of course, they can have rice with a lot of vegetable. Dinner, probably pasta with vegetables. So they can add vegetable for all dishes. Then where's the fruits? Of course, fruits is a snack. So it's a sweet. So in between meals, you might drop your glucose level. When you have something sweet, it maintains your glucose level. You feel happy. So fruits is a best snack. So we encourage 2 fruits probably mid-morning, another fruit probably afternoon like this time. So they can have 2 fruits per day minimally, and they can have a lot of vegetable when they eat it like that. So we achieved some results also. This study mainly focused about a weight loss. We found there are significant weight loss with this kind of concept. Of course, we didn't see other biochemical parameter changes. Reason this is a post-MI patient with the medication, but we saw some results for the obesity. So in my last slide, I want to give some practical advices. Even when you're coming to China, we got a pickle, we got a fruits, sorry, there's a vegetable, but it's with the salt. So don't add salt for the when you're eating fruits and vegetables. Some people they add salt for the fruit juices also. No salt with the fruits and vegetables. It should be very, very minimum. And try to have a fresh and dry fruits as a healthy snacks. And add vegetable for the all main meals. And it should be always fresh as much as possible, less cooking. And go for the more variety. Variety of fruits and vegetables provide a variety of nutrients. So in summary, low fruits and vegetable intake considered one of the main diet issue with leading to the cardiovascular disease problem. And almost all guidelines encourage minimum 400 grams of fruits and vegetables per day. And there are conceptual challenges also for in definition and portion sizes. So you might need some photos for that. And adding a vegetable for the main meals and fruit as a snack is best practical solution. Thank you for your attention.